So it's so good to see you guys. So today I'm going to be answering your questions about a really hot topic in the natural health space, which is, do we really need supplements? So this is an issue that, I'm pretty passionate about. And so we're going to talk all about that today, and I'm going to answer whatever questions you have as well. Okay, so let's dive in. What do you think? Tell me, do you think that we need supplements? Probably you have an idea that you might need some supplements if you're even here listening to me today. So the short answer is that for the vast majority, if not all people, most people do need supplements. We are living in a soil depleted world. Our soil is not as, doesn't have nearly as many nutrients as it used to have. We are being exposed to an enormous amount of toxins in our air, in our food, GMOs, pesticides, herbicides. We're eating a lot of junk. They're just toxins in our air and our environment. And so, we're learning how these things affect us and our ability to process them. And then many people, of course, that I see that are dealing with chronic health conditions are also dealing with issues such as candida or SIBO, small intestinal bacterial overgrowth, parasites, leaky gut. And when you have these, it reduces your ability to digest and absorb properly. So of course, you may need some supplements, either long-term or short-term, to sort of overcome these imbalances. And of course, if you're somebody dealing with a chronic health condition, I typically in my clinic do use supplements to help people either, again, in the short term and or the long term. If you came over to my cabinet, there would be a lot of supplements if you opened up the cabinet. If you're somebody dealing with a chronic health condition, you didn't get there overnight, and likely you got there from some environmental factors, but you might have also gotten there from some nutritional deficiencies, whether they were just inherent in you, because we now know through epigenetics and through SNPs, blood, genetic SNPs, like they test for in 23andMe, that we're not all the same. We all need different amounts of different nutrients depending on our genetic SNPs and how well we can utilize the nutrients that we're putting in our body. So you might have gotten into a chronic health condition because you just sort of naturally are low in, say, folic acid or folinic acid, because you might have mutations at MTHFR and you're not able to, readily absorb folic acid or folinic acid when you're eating it in your diet. And then you might be somebody like me who has two mutations, and then you've been exposed to high amounts of heavy metals, for example, and then they're also decreasing your ability in an already decreased way. Or maybe you're somebody who is on methotrexate because you have an autoimmune condition, and then methotrexate decreases your ability to methylate. And then if you already have problems methylating because you have a mutation or two at MTHFR, and then you have you add methotrexate on top of it, and then you have a high heavy metal burden, you could really, be setting yourself up to a position to where you just can't process, folate at all. Or your ability might have been diminished significantly. So you can see how both our genetics and the environment can set us up for situations like this. And then, of course, even if you're, eating organic, you're, filtering your air and all this other stuff, again, just based on our genetics, we might have issues. So I really suggest that people filter their air, they filter their water, they eat organic food, right? So that we have less toxins just coming into our body. And then, of course, we're stressed out, right? Everybody says, well, why is gluten such a problem now? Well, we deamminated it, meaning it can now be water soluble and get into any and everything. And then we're eating so much more of it because it's now in any and everything. And then when we hybridized it, it meant that we had a lot more gluten in our wheat than we ever did. But that's not all. We're living in a toxic world. We have leaky guts from infections and toxins and stress and C-sections. And then we live in a stressed out world. We're all stressed out. So you put all that stuff together, that's what's creating this sort of perfect storm. And I'm only using gluten there as an example, but that's really related to the perfect storm of, kind of all chronic illness and how we're in this boat right now. So I do believe that most everybody can benefit from having what I call the 4 essential supplements. So, even people who are eating really high quality organic diets, eating autoimmune paleo, eating paleo, even following the Myers way, because of our stress, because of our leaky guts, because of the toxins in our environment, because we are all genetically unique, most everybody could really benefit from what I call the 4 essential supplements, the Myers Way Essentials. And in fact, I've bundled them as a kit on my website because they're so key and important for most everyone. So it contains the Myers Way multivitamin, which is really great for anybody looking to maintain optimal health. And I specifically designed it for anyone dealing with Hashimoto's and Graves. So I wrote about this in my book, The Thyroid Connection. So it has key nutrients such as iodine, selenium, and zinc that are missing in many multis and that are super crucial in order to make and convert our thyroid hormone. So all the ingredients there, I picked the most absorbable and bioavailable forms of these vitamins and nutrients. People often ask, can you absorb these okay if you have leaky gut? And the answer for most people is yes. If it's a capsule, so it breaks apart very easily, and then you're dealing with very high quality prescription grade forms of these types of vitamins and minerals. A probiotic, everybody's hearing about our microbiome and how so important the microbiome is these days. So probiotic is really key. For my daughter, Elle, we started her on a probiotic from the day she was born. So we know that we have more bacteria in us and on us than there are of our very own cells. And, having a balanced microbiome is so, so important. It helps to keep the bad bacteria out. It helps to keep the yeast out and in check. I like to think of the gut as a rainforest where everything's in balance. Well, unfortunately, many of us, our systems have gotten out of balance from C-sections, from antibiotics, from poor diets, from stress, from medications. And so really maintaining a good optimal microbiome is crucial for optimal health. So the probiotic that I carry on my website and the one that is available in the Essentials kit is a 30 billion probiotic, which I use for maintenance or for children. We also have 100 billion, which is great if you're dealing with leaky gut or you're just starting out. They're stored in a nitrogen sealed blister pack, so they don't need to be refrigerated. Now, if people have SIBO, I typically in my clinic will recommend my patients with SIBO to use a soil-based organism. The one that we carry is called Primal Earth, and that also does not need refrigeration. But the lactobacillus, one of the main bacteria in the main probiotic that I have, is the same bacteria that often can be overgrown in people with SIBO. So that's why I typically will recommend to my patients with SIBO to use a soil-based organism or Primal Earth. And then, of course, in the Essentials kit, we have the omega-3s because inflammation is really the root of most all chronic illness. And increasing your amount of omega-3s can have a really big impact when combating inflammation. So these oils or fats help to support our cell wall integrity so that our thyroid hormones can get in and your cell is nice and fluid. Our cell membrane is made from fats. And so you want them to be nice and fluid and fluffy and buoyant so things can pass, to and fro from the cell wall. There are also some studies showing giving boost in cognitive function and even mood stability because our brain is 60% fat. So of course you can get omega-3 fish oils from fatty fish. You need to be extremely careful about where you're getting your fish that is not contaminated with heavy metals like mercury, that you're always using wild caught, fresh, not Atlantic and not farm raised. And you do need to eat a lot of fish if you plan to go that way with getting your fish oils. The omega-3s that we carry in my store are 5-star certified to be a monoglyceride fish oil. So it ensures that the mercury has been removed and that it can be absorbed much more readily than a triglyceride. The monoglyceride is much more readily absorbed than a mono ethyl ester or a triglyceride, which many fish oils out on the market are using. So that effectively means that you're getting about 3 times greater EPA and DHA through the absorption of the fish oil. So each capsule effectively contains 1,300 milligrams of fish oil, which is 600 of EPA and 260 of DHA. So, and then the last one, that for the very, very, majority of people are vitamin D deficient. And so I recommend that most people, certainly in my clinic, it's very rare that I see someone who is not not having optimal levels of vitamin D. I rarely see anybody who already has optimal levels of vitamin D, and I only typically see that if somebody is actually taking vitamin D. So the reference range, depending on the lab, is 30 to 100, and most people will say optimal ranges are around 50 to 70 in terms of prevention, potentially from colon cancer and breast cancer. So you always want to take your vitamin D with K. There were some studies showing that vitamin D without the K in it, that the calcification that was happening was not just in the bones, but also in people's arteries. So always be sure to take your vitamin D with K2, please. So vitamin D is key in supporting your immune system, both in fighting off infections and helping to balance the immune system for autoimmunity. It helps you, of course, absorb calcium into your bones. It can regulate neurotransmitters and moods. And it's really, like I mentioned, important to always pair that with vitamin K. So the vitamin D that we have is set in MCT oil that's derived from coconuts. And the liquid has 1,000 IUs, international units, per 2 drop. So we also have a capsule version, which is 10,000 units. Now, if you're taking a dose that high, I'd want you to consult with a physician to do that. Most people can safely take 1,000, even 2,000, up to maybe 5,000. Again, it's best if you consult with your physician and get those labs checked, because vitamin D can be toxic at higher dosages. And some physicians are even, recommending like 50,000 IUs a day. Now, I typically don't recommend that for people. Our body was designed to get vitamin D every day by being out in the sun every day. And I don't know that our body really knows what to do with one giant dose a week. So I find that it's typically better to have your vitamin D spread out into smaller doses throughout the week. And again, it's a fat-soluble vitamin. Any fat-soluble vitamin can be toxic because they're stored in your body. You don't just pee them out. And so you definitely would want to be getting your labs checked by a physician or an online laboratory where you can check your vitamin D levels and shoot for between 50 to 70 as the level in your blood. Okay, so then my next favorite supplement for me that I kind of can't live without, because I have 2 mutations at MTHFR, is Methylation Support. So I take 2 of these a day. So this is really helpful if you have 1 to 2 mutations of MTHFR. And it's for those people who maybe they're able to absorb their B vitamins, but then they can't utilize them. So getting a B vitamin level checked or a folic acid level checked in your serum isn't all that helpful. I mean, if you're low, you're probably low, but if you're on a vitamin and it's normal or high, it really doesn't tell me as much. What you want to know is functionally how you're able to utilize this. So your genetics can tell you some, and then there is some functional testing that you can get done for this. I use something called an ion panel. So these are pre-methylated B vitamins. It has folate versus folinic acid. In fact, it has 5-methotetrahydrofolate. That's a mouthful. Or folate versus folic acid. Folic acid is synthetic. So when you see that in vitamins, 400 micrograms of folic acid, the studies show that's okay. Up over 800 micrograms, which is what actually most prenatal vitamins have. There's some studies showing that synthetic folic acid can contribute to cancers. So you always want to get natural folates. The studies have not shown any effect of the natural folates on cancer. So and then methylcobalamin. So if you see cyanocobalamin, that's B12 in a vitamin. A lot of people can't process that. They have to convert it to methyl to make it their body to able to utilize it. So this already has methyl B12 in it. So it's great if you have mutations of MTHFR, if you're dealing with a lot of stress and you need the support of B vitamins. And then my 2 other favorite, whether you call these supplements or not, is Paleo Protein. and this is chocolate flavored. My favorite is mocha flavor. Vanilla used to be my favorite until we started mocha latte, and mocha latte is my favorite. But this is, I wasn't able to have a smoothie for about 5 years because I was following my program, and most smoothie powders out there are hemp, whey, egg, soy, brown rice, pea. And so there wasn't one that worked for the Myers Way diet. And then we discovered this hydrolyzed beef protein, which sounded kind of gross, frankly. And I was a little scared to try it, but when I did, it was amazing. It made the fluffiest, creamiest smoothie that was, tasteless except for the taste of the protein powder. So now I'm addicted, and I drink a smoothie literally every day. Here's my leftover from this morning. So it's real. I really do. I usually put it in a glass cup, but I made one here at the office instead of at home. So that's real. That was my leftover mocha latte smoothie from this morning. So it's from hydrolyzed beef protein that's grass-fed, pasture-raised. The cows were never given GMOs, hormones, or antibiotics. And we have 4 amazing flavors. We have unflavored vanilla, chocolate, and mocha lattes. And then another great one is the collagen protein powder. This is another favorite of mine. I usually will put this in my smoothie, but if you're looking to repair a leaky gut or help maintain a healthy gut, this is awesome. Our gut tight junctions, or our villi, are made up of collagen. So this can help in to restoring your gut. It also helps with hair, skin, and nails. My hair, skin, and nails grow like, well, not my skin, but my hair and nails grow like weeds. Right now, my nails look kind of icky because right before I went to New Zealand, I did for the first time one of those gel manicures, which was a disaster. Never do that again. And it kind of ruined my nails. It was great while it was there, and then they literally all fell off on the trip. I was told it was going to last a month, and about 3 weeks in, they were just like falling off, and it was like pulling my nails off. So anyway, I'm trying to grow them all back out and doing lots of collagen, and hopefully in just a couple of weeks, I'll have gorgeous nails again. So that our collagen is also made from grass-fed, pasture-raised cows that were never given GMO, hormones, or antibiotics. And then one that's not listed here, but is another one of my favorites, or my 2 go-tos that are in my cabinet down there for my personal use, are my 2 go-tos when I'm potentially dealing with a moldy issue. Glutathione, which is the #1 detoxifier in our body. And so if you're dealing with a chronic illness, a lot of people, there's studies showing people with autoimmunity and even cancer have low levels of glutathione. And then, so I don't know if they have low levels from their disease or they got their disease from having low levels. Probably it's a little bit of both. So this is my absolute go-to, and I take this with me everywhere. And then coconut charcoal to bind anything. And in fact, I should leave these out on the counter because I am traveling tomorrow on a plane and then going to stay in a hotel, and those can typically be moldy. So my store is really organized into categories to help you find supplements based on autoimmunity, thyroid, gut issues such as leaky gut, candida, SIBO, and parasites, toxins, and sleep. So basically the 5, root causes, or the 4 pillars that I talk about in all of my books, we've organized the supplements in that way on the website as well. And then of course we offer wellness kits with a 10% savings because they're all bundled together. So people who are just getting started out, they don't know where to begin. A lot of times they like to just pick a kit because I kind of bundled everything that belongs in that kit. So we have an essentials kit, we have an autoimmune kit, we have a leaky gut breakthrough kit, we have a detox kit. So we have a lot of different kits. We have a children's kit. So lots of different kits if you don't know where to start.